Appreciate you taking the time to learn a little bit more about Trinity Rehab. As you all know, that we're very excited about our new partnership with Trinity and just an opportunity to enhance outcomes here at Springmore with the therapy services that they are going to continue to bring to our community. We have with us today Jamie Sutherland. He is the Vice President of Operations with Trinity Rehab, as well as Camille Smith, and she's the area director that's going to be servicing us here at Springmore. So I will allow them an opportunity to share what the next few weeks and months are going to look like with the transition, and just hopefully ease your minds and just help you to better understand about what they're going to offer to us, and just hopefully you're going to be as excited as we are about this new partnership. So I will turn it over to Jamie.
Good afternoon. We appreciate the opportunity to be here. I'm going to tell you a little bit about me, and then I'm going to let Camille tell you a little bit about her, and then we'll get started, okay? My name's Jamie Sutherland. Like Jessica said, I'm the Vice President of Operations for Trinity Rehab, but I'm first and foremost a physical therapist by trade. I've worked long-term care, CCRC, skilled nursing for 20 years, ever since I graduated from Carolina. So that's my oh, sorry. I talk really fast, sorry. That is my professional background, but have been the Vice President of Operations for Trinity Rehab ever since we started in 2012/13. So I'm going to let Camille give you a little bit of her background, and then I'll get started with exactly who we are and to really answer the questions I think you came to hear today. So Camille.
Hi, everyone. I'm Camille Smith. I'm speech therapist by trade. I've been with Trinity Rehab and their sister company of Carolina Therapy for 7 years, and I've been mostly with the CCRC community, so I'm familiar with kind of the environment and the residents that we serve in that population. So we're excited to partnership, like Jessica said, with you all, and hopefully answer a lot of the questions that you have and make you feel reassured in this transition.
All right, now, let me get something out of the way really quickly. Brooke will remain as the program manager in your therapy department. It's really important to us to maintain the staff that you have. We've been able to maintain the majority of your staff, but we've also had to add some different pieces into your staff. So we're excited. We're excited that Brooke's going to lead us in this transition. I know you all are excited that Brooke's going to continue to be here. So that was really important for us, and it was the first piece of business we took care of when we were able to start this partnership. So let me tell you a little bit about Trinity Rehab. First and foremost, we're a North Carolina only based therapy company. We don't provide services in any other state consistently other than North Carolina. We do have one building in Virginia, but it's part of a group of business that we service. So that is in Suffolk, Virginia, but that is not our calling card. We are a North Carolina only based company with our corporate office in the big town of Dunn, North Carolina, if anybody knows where Dunn is. Our office is right there on Main Street. The president of our company is born and raised in Harnett County, and it was important that when we started that we stayed true to our roots in a small North Carolina town. So that's what we do, right across from the downtown delis where we're located in Dunn. So I say all that to say that we really put up huge emphasis on relationships and customer service. We are a therapy company built and designed to service CCRC communities like Springmore. That was our foundational principle back in 2012 and 13. We partnered with a group called Lutheran Services of the Carolinas, who own several nursing facilities throughout the state. And the desire was for us to grow into a company that serviced their market. And really focused on the independent wellness aspect of therapy, as well as assisted living and skilled nursing as a team and group effort. So that is what we were built to do. And I say that because the differences between us and bigger national companies are that they don't have a sole focus on CCRC communities. So a lot of times what you get is they're trying to fit their skilled nursing model into a box for CCRCs, and that just doesn't work. So we have probably 20 different places throughout the state of North Carolina that we service, but we don't grow just to grow. Jessica and I started having conversations 6 to 8 months ago. I've known and worked with Jessica for 10 to 12 years in her former life as an administrator back in Fayetteville, North Carolina, which is where we both grew up in skilled nursing. So, like I said, we're a relationship company. We're relationship driven, and that's what we take pride in. So we grow into places that we feel are good partners for us, and that where we can have our mission, vision, and goals align with that of the community in which we're joining. Okay, so up until 6 years ago, we stayed the exact same size because we really couldn't find those partnerships. We have another community in Cary, North Carolina called Glen Air that we service. We've been there probably 3 or 4 years. Beautiful facility and community. And we've got a relationship with that entire group of business that used to be Presbyterian Homes, and then they changed to Bright Spire, and now they've changed to Kentura. And so everybody keeps growing and expanding and changing names. But we are focused on being in communities that we feel like are similar to us in our vision and our values. Okay, so that was one of the reasons we pursued the conversation with Jessica, and really, really excited to have the opportunity to come here and service you all. That's just a little bit about who we are as a company. Like I said, I helped start the company, so I could stand up here all day and talk to you about Trinity Rehab and my beliefs in us as a company. But let me give you an idea what this looks like for you on February the 3rd, which is that Monday. The idea for us is that on February 3rd that you see zero difference in what happens with your therapy services, okay? If you're currently on caseload right now today, you'll continue to be on caseload on February the 3rd. And Brooke will have that schedule or whatever schedule you all have worked out, and that is the schedule that you'll continue to follow, okay? On our end, we'll do a lot of the behind-the-scenes work with regards to your insurance, making sure that we get insurance verification for us as a different billing company, because that's really the only difference, is that we're a different billing company from Legacy. But you won't see or be involved in any of that other than maybe providing a updated insurance card if Brooke doesn't happen to have it or they don't happen to have it here. Okay, so from a transitional perspective on February the 3rd, really nothing changes for you all, okay? The idea is that it is seamless, it's easy, especially if you're currently on therapy. There's no issue for that. Also, the idea is that if you have an order that is pending, or what I call on a waiting list, that we get you addressed very, very quickly at the start of February. Okay, I told you all that I'm a PT by trade. Camille's a speech therapist by trade. We also still treat and evaluate residents when we need to jump in and help. So my guess is once we start talking to Brooke and figuring out who has an order and who needs to be seen, who has not been seen, I'll pull some additional resources in from our operations team to get you guys seen in a quick and timely manner, and your orders addressed. You should not be waiting to have your evaluations done, okay? So that's important to us. The expectation for us is that if you get an order, you go out and see your doctor or you see the clinic here, as soon as we get the order and get your insurance information, we will get that authorization taken care of in 24 hours or less. Okay, we have one person in our office that does all of our authorizations for us. And that is the reason we have just one person, and she's in the big town of Dunn, North Carolina as well. So we'll get that authorization done and get your eval scheduled in a very timely manner, depending on your schedule, and as soon as we can get the schedule done with the PTs and the OTs and the speech therapist here. But what we don't want to have is a waiting list because we don't have enough staff to service you as a group. So we will. One of our first conversations Brooke and I had was, what does your current staffing look like, and what does your dream staffing look like? So we'll get in and kind of figure out what that looks like, and my guess is we'll add some staff here and there so we can accommodate each and every one of you, and you don't have a waiting time in between your eval order and your actual therapy treatment. Makes sense. The expectation also for us is that we're doing evaluations down in the Stewart Health Center within 24 to 48 hours at the most. 48 hours would be the longest that you, as a short-term admission resident down in Stewart Health Center, should have to wait to get a therapy eval. So if you go out, have an elective surgery, or if you go out to the hospital, have pneumonia, come back, have a need for therapy, we need to get you taken care of within 24 to 48 hours in terms of an evaluation. Also, if you're a short-term resident down in Stewart Health Center, the expectation is that we're going to see you 6 days a week for therapy. And I know that's a change, and I'm not telling you anything that Brooke and I hadn't already talked about or that the team is not aware of. But if you're there for a short-term reason in Stewart Health Center, then you need to be able to receive services 6 days a week. Because my guess is you're trying to get in and out as quickly as you possibly can. So it's incumbent upon us to provide the therapy that you need to make sure that happens. Now, obviously, that's done on an independent basis, individual basis, depending on what your diagnosis is, what your tolerance is, but that'll be the expectation for us once we get in and get established. Okay? Yes, sir.
What about independent living patients?
Yes, sir. Independent living, like what? What?
You would see everybody within 48 hours.
Yes, sir. Yes, sir. So if you come to us as an independent living resident, the question was, what about independent living residents? How quickly are you going to see us? So if you come to us with an order and we have your insurance information, we will do your insurance verification within 24 hours. And it will be sent back to Brooke as, all right, this is okay, we're good to go here. And she will schedule your evaluation within 24 to 48 hours, depending on your schedule. Yes, sir. We are. Actually,
They have all that information.
sir?
They have all that information.
They do. Yes, sir. Yes, sir. Right. You don't have to provide all that information. If you're dealing with the insurance department here, my understanding is you don't all deal with the insurance department here. So some of you will have to get that information from. Yeah, we just left one meeting with that group and we had a great conversation, and we'll continue to have those meetings to make sure that is an expedited process for us. So you all are in a unique situation that is unique to me anyway, in that you have an insurance department here at Springwood that handles that handles a lot of that for you all, which will be really nice for us to have a centralized place to get all that information. So yes, sir. Yes, ma'am.
Well, I have an order now.
Nice.
And I just have to pick it up at the doctor's office, and now, how do I handle this? I have been registered, I have been with PT, with Legacy, with Brooke.
Mm-hmm.
But what do I do now with this one?
You can hand it to me. I'll take care of work with Hines.
Yeah, so I'll let you deal with Brooke on that, and won't comment any further. You should be able to get your treatment now, I guess is my point. You should not be waiting on us to come February 3rd. So Brooke can take care of that for you as soon as you get done. Okay. All right. Insurance companies. I know your other questions are, what insurance do you take? Are you in network with this insurance? Are you in network with that insurance? I've got a big long list of insurance companies we're in network with, but what I want you to hear me say and what I want you to understand is it doesn't matter to me if we're in network with your insurance or not. We're still going to treat you. And you're really not going to know if we're in network because we're going to take the out-of-network price and payment, and you're not going to be billed as if you're in network. Does that make sense? We're not. I just walked in an hour ago, got an email that there was an insurance company, Aetna Medicare Prime, which is a subsidiary of Aetna Medicare Advantage, that we're not in network with, but we've treated 2 residents, and those residents will know no different. And so what we'll do is work on the backside to get in network with that individual plan down the road. But you won't know that. You won't see that. We won't withhold coverage from you or treatment or anything like that. That'll be incumbent upon us to make sure we get in network with that provider later on, or that insurance company. So that's another big difference for us, is that you're not going to not know if we're you're going to always believe that we can provide you service here at Springmore, because that's what we're going to do. That's the important piece for us, is being able to provide service for everybody who needs therapy, regardless of your insurance. Okay? Any questions about insurances specifically?
How's the billing gonna work? Like, you have co-pays?
Yes, ma'am. That's great. That was my next topic. So billing for us is really important in terms of our communication with you all. Now, I'm going to give you an example of you as a resident who doesn't use Springmore Insurance, okay? So that let's talk that way. What'll happen is if you receive treatment in December, let's say you receive treatment December 15th, we will bill your insurance at the end of December, okay? We will allow 30 days for that primary insurance to pay your coverage. And then 15 days after that, so February 15th, if you have a copay, you will receive a statement or an invoice from us as Trinity Rehab. So it should be probably 45 days when that invoice goes out to you, okay? We will touch base with you to make sure you understand the invoice. If you have any questions about the invoice, Brooke will have an idea what that looks like, so she'll have an understanding but won't be responsible for that totally. But the idea is that you will get that 45 days after the conclusion of that month that you receive service. Does that make sense? Does that answer your question? It won't be 6 or 8 months later down the road. I can promise you that. And even more expedited if you deal with, well, it'll be the same amount of time if you deal with Springmore Insurance as well. We'll just deal directly with them, but it'll be the same time frame. Yes, sir?
Have a primary and secondary insurance.
Mm-hmm. Yes, sir. We'll bill the primary that initial time. Once the primary pays, we'll bill the secondary, but we're not going to hold your invoice for a copay until all of that adjudicates down maybe 6, 8 months down the road, which is what you're dealing with now. We'll go ahead and send you the copay invoice or bill, or so you know what that is. If you're like me, you want to get your bills paid. You don't like things hanging out over your head, so we'll go ahead and get that taken care of. But yeah, we'll do primary, secondary, tertiary, any types of insurance coverage you have, we will bill all of that. And we do it out of done. 2 specific ladies. If you have a question, you'll call and talk to either April or Brittany, and they will know exactly who you are, and they'll be familiar with your bill. Okay? It won't be a big national group that you get a different person every time you pick up the phone and call. So the idea is that the customer service we provide is a much more direct opportunity for us to help you all going forward and answer some of those questions in a timely manner. That makes sense. Okay? Any other questions right now?
I guess I don't understand how the Springmore insurance works.
I defer because I heard about it about 2 seconds ago. So
All we're doing is Donna can keep all your information for you. She helps make sure any explanation of benefits that you get, you can turn it into Donna McGee in the business office. She'll make sure that, analyze it, tell you, yes, you need to pay $50, no, you don't need to pay. She keeps up with your insurance cards so that they have access to it, other entities would have access to it. That's kind of the main gist of it right now.
It's a great service if you don't accept it, because not only they work well, but they work well with us, and we can communicate back and forth if there's any questions. So it's a great service if you're not with that. I highly recommend it if you have questions about your statements or anything like that.
yes, sir.
Jessica, doesn't everybody have to turn in their insurance card to the insurance company?
To the insurance department?
EMS is involved.
Absolutely. It is recommended that we keep those up to date and on file so that we can have those readily available, but recognizing it's highly recommended but not required. So it's just one of those things that individually we do recommend that you keep those on file and up to date, recognizing they change annually to provide those to the insurance department so that we can get those in the records.
There's very much required of EMS's calls
Yeah.
because we get a piece of paper from the health center giving the information
Yes.
to the emergency room.
Correct.
Therefore, having your information in the insurance
Yeah.
department.
And it is very necessary. It's also helpful with our partnerships because we're able to provide that directly to them behind the scenes, and it helps to reduce any delays that there may be. So we do have that partnership, and that information being correct on file, it does help.
It's a requirement at move-in, but you're not required to update it.
So Brad said it's a requirement at move-in, but annually, it's highly recommended and encouraged.
So my question is,
Oh, yeah, sure. Yes, ma'am?
my question is, who files if the insurance with the service that you give us?
We do. Trinity Rehab.
And you file it with my insurance?
Yes, ma'am. We'll file it with your primary insurance. We'll file it with if you have secondary insurance, and we'll file it if you have tertiary, third level insurance. Yes, ma'am.
I think your point is you don't have to do anything different than you have been doing.
That's correct. 100% correct. And also too, yeah, nothing will change for you in terms of what is required. My hope is, in talking to Jessica and Brooke, is that we can expedite the process and make it a much more customer service friendly environment for you all. And get a lot of those questions answered on the front side for you. You'll know when you bring an order to Brooke and we verify your insurance, Brooke will know and you will know what your copay is, what the expectation is, how many visits have been authorized. That's no different if I were here, Legacy was here, another company was here. Everybody does the same thing. Sir, ma'am?
I was just saying, I don't feel like that got done
Well,
before.
well, I can promise you it'll get done now. Yes, ma'am. I promise you it'll be done, and Brooke will have that information, and it will be communicated to you. So everybody's on the set. There is no question as to what your insurance covers, what your responsibility is, how many patient visits were authorized, and what we need to do to continue that service. Yes, ma'am. Yes, ma'am.
Can you give me some approximation of the size and the qualifications of the staff? Are they PT techs or are they physical therapists? Do they have PhDs? Can you repeat the question?
Sure. She asked if I could give her an idea of the qualifications of the staff, whether they were PT techs or whether they had PhDs. My guess is none of them have PhDs. I don't have a PhD. Therapists are required to have master's or now entry-level doctoral degrees. I can't sit up here and tell you. I know we don't have any techs. Okay, so I don't know the staff well enough to tell you. Brooke, you want to answer that? You can answer what. Brooke's worked with her staff for a long time, so she can give you some of that information.
Hello, everyone. The news is finally out. The elephant is in the room. So the staffing, I'll go ahead and let you know kind of who's staying while we have here. So Shelby's back here. She's our wonderful speech therapist. She has a master's degree. Brooke, I have a doctorate of PT degree. And then we have Logan. She has a master's in occupational therapy. We will currently have a few other PTAs, which is physical therapy assistants. That is an associate's degree, but they can do just what I can do, except I have them in charge of the paperwork. So we are both qualified. Everyone knows what we work together with. So even if it's assistant or a regular therapist, they are well qualified. They're well trained. We work very closely together. We know each other's care plans. We talk every day in the mornings or throughout the day if we haven't seen any changes in someone's condition or anything that needs to be altered. Of course, if they have to consult with a therapist on if a plan of care needs to be changed. But the only really difference is we get paid for the paperwork compared to our assistants. So, any other questions?
Yeah, the newer staff members that we've hired to come work, the occupational therapist has a master's degree, I think. The PT that we're currently talking to supplement and help Brooke has a doctoral degree. All PTs that come out of school for probably the past, I graduated in 1998 with a master's degree, and so probably after 2004 or 5, they transitioned to doctoral degrees. Which in my opinion just means you pay for an extra year of school to get the same amount of education, but that's I won't get on that soapbox. But so yes, ma'am, we will employ probably a rehab tech, but that rehab tech will be mostly to supplement what your licensed therapists do. All of your therapists are licensed, have to get renewed every year. And so that person can't provide any skilled service for you. The other thing I wanted to touch on was our involvement and interaction with your wellness program. One of our staples in all of our communities is our relationship with wellness. And the idea is that we really are a team. So if you're taking a wellness class and you've been taking that for 6 months and all of a sudden you're not able to participate as much, that the wellness department picks up the phone and has a conversation with Brooke and says, hey, Miss Smith isn't doing so much in yoga. Maybe she needs some therapy. With the idea is that we turn around and get you right back to your wellness program. So we're not trying to steal you from wellness. We're not trying to be a substitute for wellness. We're really trying to make sure you stay actively involved in those classes and that process. A lot of our discharge, when you get done, a lot of what we'll do is coordinate with the wellness. Hey, Miss Smith is done with therapy. Maybe this class and this class and this class and wellness would be beneficial to continue on what we've started during therapy and skilled service. Okay, so I don't want you to feel like that it's an adversarial relationship with wellness. It really is a collaboration and a partnership, and one we take very seriously. We also like to have our therapy department do a presentation or some sort of program for you once a month. And that really can be driven by you all. You know, what does that look like? Do you desire to have a program on technology that maybe occupational therapy can help with, or a driving program, or a balance program, or any specific? I know you just started a Parkinson's support group or Parkinson's program that we're super excited about being a part of. So anything that your therapy department is currently involved in will not change. As a matter of fact, all we'll do is supplement and increase our involvement in your community and your programs. And if you have a specific need or desire to start or see us focus on multiple sclerosis or Parkinson's or arthritis in terms of using the pool, please make sure you communicate that with Brooke or anybody else so we can focus solely on what you need as residents at Springmore. Okay. We've got a huge variety of things we've done in other communities, but like I said, this community, although similar in how it's set up and its style, is probably extremely different in your needs and your desires and your wants, and how we can help supplement and complement that. Okay? What have I missed? I'm sure I've missed something. Yes, ma'am.
I've heard Brooke's name come up many times. Do we as residents get the opportunity to still work with her, or is she just going to be on the administrative side?
Yeah, no, you'll have the opportunity to work with her. Now, I will tell you that as the manager and director of this program, she's not going to be treating patients 8 hours a day because it's unfair. First, it's unfair to her. And as much as she wants to treat all of you in here, and as much as you love her, and I know you do, treat her as a therapist, treatment as a therapist, she has to be given the opportunity to lead this department and its collaboration with you as a community. And she cannot do that if we're asking her to see 6, 7, 8 hours worth of patients each and every day. So although she will be still treating patients, I would guess it's not going to be as much as she's used to or you're used to her actually having to treat patients. And that's not a knock on her. I want you to understand it. You know, she's welcome to treat patients all day, but it's not fair to her to ask her to do both. And we'll make sure she's got the support that she feels supported. The other thing that's different between us and big national groups is Camille, who is her direct report, she's an area director, has 6 or 7 other communities around the state that are kind of clumped together. She lives in Holly Springs, North Carolina, which is 35 minutes from here. So I say that to say she'll be here to provide Brooke support, to help with some of that collaboration with you all, and to give her an opportunity to feel like she's got some support outside of you as a community and Jessica and Brad and all those, to make sure she feels supported on our end. We've got a clinical specialist. Her name is Heather Klein. She's a physical therapist by trade, and she lives in Cary and has done a lot of work in CCRC communities. So we're excited to have her as a support person as well for Brooke and her staff, and for wellness as a partnership with wellness and doing some of that programming. Yes, sir.
The announcements we received earlier, I had the impression that you would be covering some areas that are not presently covered.
Such as?
Bringing additional programs to the community.
Oh, bringing additional programs to the community. Yeah, yes, sir, we will. But again, I've got a list of 22 different programs that we've done in other places that we can bring, that I can provide for you all. But I really like to get in and figure out what you all want and what you want to see. I don't want to we don't want to have the speech therapist do a program on cognition and using iPads and things like that if that's not something that's going to be beneficial for you all as a community. So that'll be really is tailored to you all. But Brooke will have the ability to have more time to collaborate with you all to come up with what that looks like.
Okay, so the generator on their side and what
Yes, sir. Yeah, well, and really, if you have an idea what that looks like, something that you all want to see. I had somebody approach me when we were in a facility in Asheville to talk to me about Guillain-Barré syndrome, and they'd like to have a program done on therapy for Guillain-Barré, which is a neuromuscular disorder. But it was very specific to that community. I don't want to do that here if it doesn't benefit anybody. If that makes sense. The idea, yes, ma'am. Mm-hmm. Can we expect more stability? I sure hope so. The plan is that you will have dedicated staff at Springmore, not staff that works at Springmore and somewhere else. 2 days a week here and 2 days a week somewhere else. The idea is that your staff is committed to you as a community. And the idea is that we keep them very, very long term. I don't want to mislead you in the fact that the market for therapists is extremely competitive. The younger therapists who come out after being in school for 3 years with $120,000 worth of debt oftentimes chase rate and dollars. And that doesn't really align with who we are as a company. So we really work hard to make sure we employ the right people and people that are going to be here, like Brooke has been here for 8 years. When I walked in and talked to them, what I told them was that they are committed to you all, first and foremost, then to Springmore, and then to their therapy company. And all we want to do is to be a supplement for them and provide them support so they can provide your therapy. So the goal is that your staff is extremely stable. But I'm also not willing to not put staff here on a short-term basis to fill needs so you're not having a waiting list, if that makes sense. So, we could have a therapist here who's here 13 weeks as a travel therapist so we can make sure we're providing the service we need to provide until we find the right person to fill that full-time slot. That was I appreciate you bringing that up. Yes, ma'am. Yes, ma'am.
And they work out and they go to stay here for a while. Is there an opportunity for them, for their salary to increase?
Yes, ma'am.
Looking to go someplace else?
Yes, ma'am. So another thing that is different between us and a bunch of big national companies is they will have opportunities for annual reviews every single year. And with that annual review comes an opportunity for a salary percentage increase every single year. That's based off of performance, but it's never something that we have withheld from any employee that we have. We have 157 full-time employees, and we've never withheld your review, because we owe you to have a review, and your opportunity for salary advancement for exactly what you just said. But I also want them to feel comfortable in the fact that we support them in other ways too, and that salary is not the only way. So we work really hard on the backside to make sure they feel supported. You know, birthday cards, acknowledgement of different good, bad things that happened in their lives. So they feel like part of our family and not just an employee. So they do have that, although they're committed to you, but they're also committed to us as well in some regard. So yes, ma'am, we do. It's important to us. And it's been a disappointing part of what I've learned with other big national companies, that they don't do annual reviews. And what they do is they throw money at them when they walk in the door, and then you don't have a chance to advance. But anyway, another soapbox I won't get on today. But the idea is that you, on February the 3rd, really see no difference in what happens with your service, other than, especially like I said, if you're on therapy, there will be no disruption in your therapy service. Okay? Yes, ma'am.
How many therapists will be at Springboard?
How many do you currently have? Well, how many? Back up. How many we've kept? How many?
We have one PT, including me and Hannah, PT, one OT, one speech is what we have right now that are staying.
Okay, so we've hired another occupational therapist, 2 PTAs, and a CODA. So 8 currently. Is what you have now. And so I won't change that staffing number until we come in and get an opportunity to figure out what it needs to look like. Do we need an additional physical therapist, or we need an additional physical therapy assistant? And Brooke will have a huge role in helping guide and direct what that looks like. She'll have a role in interviewing those therapists that come in, because it's important for us. We have currently a position we're trying to fill with a physical therapist. We've done 2 different interviews, I can tell you, and we have passed on both of those people because we don't feel like they're appropriate to be, not only work with us, but to work with you all. So we're not just going to put any warm body in here to treat patients. So we're going to do the best we can to get the right fit and the right people in here. But that staff will grow depending on what the needs are here. And like I said, with the wait list, we're not going to allow a wait list, so that'll necessitate us adding staff members here. But that'll all be done once we get in and kind of get our feet wet. Anything else? I committed to Jessica that I would put together a list of questions and kind of things we've gone over here in writing, so we can have that for you all. So some of the things we've gone over, some of the questions you've asked us specifically, that we can generate not only for you all, but for other members of the community as well. So we'll get that done in the next week or so. Okay? Yes, ma'am.
Okay, well, hopefully Jamie was able to answer some of the questions that you all have, and just know that over the next few weeks with this transition and ongoing, you will see some continued communication going out, whether in the format of memos or the resident memorandum. Trinity is going to be very active in making sure that that communication is available. So I do ask, if you have any burning questions that you don't want to wait until February to ask, just reach out to myself. You can reach out to Brooke. We'll make sure that we get the answers not only to you, but to share it with others that may have the same questions, so that everybody is confident through this transition. All right. Any further questions? If not, have a wonderful afternoon, and thank you all again for coming.